So, as you can see in this picture, this is a model of the human hepatitis B virus. And here we have the different parts of the hepatitis B virus. We have the lipid, the nucleocapsid protein, also known as the hepatitis B core antigen. We have the nucleic acid, the envelope protein, which is also known as hepatitis B surface antigen. Hepatitis B is caused by DNA genomes, and they have a very small genome which is used to encode virus proteins and to control expression of the virus genes. Hepatitis B is also known as hepadNA virus, and that's because hepa is for hepatotropic, which is attached to the liver, and DNA because it is DNA virus and it has a circular genome of partially double-stranded DNA. DNA genomes are replicated by an RNA intermediate, and that is formed by reverse transcription. All the replication takes place in the liver. The virus spreads to the blood by viral proteins, and antibodies against them are found. The hepatitis B virus is 50 to 100 times more infectious than HIV. Hepatitis B is a non-cytopathic virus, which means that the virus itself does not cause direct damage to the liver cells. It is the immune system's aggressive response to the virus that usually leads to the inflammation and damage of the liver. Now, many of us know there are different kinds of hepatitis, and so today I wanted to go over the 3 hepatitis viruses, and there are more, but I'm just focusing on 3. The first one is hepatitis A. It is a virus found mostly in the feces and blood of an infected person. Hepatitis B is spread through blood or other body fluid in various ways. Vaccines to prevent hepatitis B is available, and hepatitis B is chronic, which means long-term, and acute, which means short-term. Hepatitis C is only spread from blood to blood. There are no vaccines for hepatitis C, and hepatitis C is chronic, which means long-term. There are similarities between hepatitis, and the similarity is that it causes irritation and swelling, which means inflammation of the liver. And here are the 3 different kinds of hepatitis. History. Hepatitis B was originated from Africa and Asia. When early birds and mammal lineage split 340 million years ago, a hepatitis B virus infected the first amniotes and spread through generations. In 1981, the Food and Drug Administration approved the first vaccination for hepatitis B virus. So a little facts about hepatitis B, and as you can see in this diagram, the length of hepatitis B is 42 nanometers. We have the hepatitis B surface antigen outside here, and then we have the hepatitis B core antigen. Here is the DNA polymerase, and here are the hepatitis B E antigens. Okay, 400 million individuals are infected with hepatitis B virus worldwide. Oops, sorry. 5% remains infected through their lives, and majority in babies who acquire the infection from their mothers. Over 50 million new hepatitis B virus infections are observed in individual each year, and virus is present in the blood and semen, infects individual and are modes of transmission. Over 8 million infections are due to reuse of syringe and needles from injections. Vaccine is the most important way to prevent hepatitis B disease. Therefore, there are 3 doses are generally required to complete the hepatitis B virus B vaccine series. The first, sorry, I keep clicking this. Okay, so the first injection is given at any time. The second injection is at least 1 month after the first dose. The third injection is 6 months after the first dose. Where is hepatitis B found? So as you can see in this map, the red indicates a greater than 7% in a general population in a country, and the yellows are 2 to 7%, and the greens are less than 2%. 90 to 95% are infected as newborn, become long-term carriers, 1 to 10% infected as adults. The global burden of disease study attributed that 786,000 deaths to hepatitis B virus infected in 2010, making hepatitis B virus the 15th leading cause of death worldwide. Today, I will be talking more about China and India. There are 60% of Chinese population is infected with hepatitis B virus. Out of that, 10% are chronically infected. 1.5 million adults are carriers of hepatitis B virus just in Shanghai, and out of that, 63% are positive to hepatitis B E antigen. 500 million die each year in China from hepatitis B virus infected cause. But as we compare it to India, India is classified as having 2 to 7% of hepatitis B virus. In India, of the 25 million infants born each year, over 1 million run the lifetime risk of developing chronic hepatitis B virus infection. And when I say chronic, that means long-term. So they will be having this infection for the rest of their lives. Estimate indicates that annually over 100 million Indians die due to illness related to hepatitis B infections. An average estimate carrier rate of hepatitis B virus in India is 4%, with a total pool of approximately 36 million carriers among the 400 million hepatitis B surface antigen carrier worldwide. And this map was approved in 2005, and it is accurate. So going into more details about hepatitis B, I would like to first talk about hepatitis B surface antigen. And as seen in this diagram, we have 3 different kinds of surface antigen: the large surface protein, also known as hepatitis surface antigen, the medium surface, and the small, which is right here, here, and the large. So hepatitis B surface antigen is the surface antigen of the hepatitis B. It indicates current hepatitis B infection. It is composed of the lipid and protein that forms part of the surface of the virion, which means that the particles are not infectious. It is recognized by antibody proteins that bind specifically to one of these surface proteins, either to the large surface or the medium or small. Patients are not infectious when they develop antibodies against hepatitis B surface antigen. Hepatitis B core antigen. Okay. It is a viral protein and indicator of active virus. I don't know what you can. I'm going to do this. It is a viral protein and indicator of active viral replication, which this means that the person infected with hepatitis B can likely transmit the virus onto another person. There are multiple proteins products can be produced from the same DNA sequence. Something wrong with the clicker. Okay.
Yeah.
Which means when OR, F core, and pre-C are translated, when OR, F core, and pre-C are translated together, it results in hepatitis B E antigen. Anti-HBC appears at the onset of symptoms in acute hepatitis B and persists for life, which means that it is detected in patients who have recovered from hepatitis B and its B infection, as well as those who are chronically infected. no, I'm sorry. The presence of anti-HBC indicates that previous or ongoing infections with hepatitis B virus in an undefined time frame. Okay, so moving on to hepatitis B E antigens. It is a viral protein secreted by hepatitis B infected cells. It is associated with hepatitis B infection, and it is used as a marker of active viral disease and a patient's degree of infectiousness. Hepatitis B E antigen is the extracellular form of hepatitis B core antigen, which means that when the presence of both are markers of viral replication, and antibodies to these antigens are markers of a decline in replication. So when we take a blood test, if the results come out to be a positive, it indicates that the person has a high level of virus and greater infectiousness. And if the result is negative, it indicates that there is a low to zero level of virus in the blood. Anti-HBe is made in response to the E antigen, which when detected in patients who has recovered from hepatitis B infection, as well as those who are chronically infected. Symptoms. There are a few symptoms when a person has hepatitis B, which is jaundice, nausea and vomiting, weakness in the body, loss of appetite, dark urine, and abdominal pain. Sorry. Okay, so also in symptoms, most of the individuals are able to recover completely from an acute infection. And when I say acute, that means when a person has a short-term disease of hepatitis B. However, if the body is unable to mount an effective immune response, a patient may become a chronic carrier of hepatitis B virus. Diagnosis. Infection is diagnosed with blood tests. These tests can detect pieces of the virus in the body. Blood tests for hepatitis B virus are often done when the blood work shows abnormal liver functions. Serum, vaginal mucus, and saliva and tears are also found in low levels in a person who has hepatitis B virus. There are 3 tests for blood tests for hepatitis B. Okay, the first one is surface antigen test, which is when hepatitis B surface antigen is part of the hepatitis B virus that is found in the blood of someone who is infected. I think it's time. Okay, so when the test comes positive, when the test is positive, it indicates that there is hepatitis B present in the individual person. Surface antibody test, which is also known as HBsAg, is produced in response to the hepatitis B virus or vaccine. Positive indicates that the immune system has successfully developed a protective antibody against the hepatitis B vaccine and may provide long-term protection. Core antibody test, HBsAg, does not provide any protection against the hepatitis B virus. Positive indicates that a person may have been exposed to the hepatitis B virus and is usually present in those who are chronically infected. But when this test is done, there is also sometimes false positive, which can also scare a person who might think that they have hepatitis B, but they don't have it because it is a false positive. So moving on. I wanted to focus on a research paper of all the research papers that were out there, and the research paper was called Vertical Transmission of Hepatitis B Virus from Mother Negative for Hepatitis B Virus Surface Antigen and Positive for Antibodies to Hepatitis B Virus Core Antigen. This paper was published in 2009 by a group of researchers. By a group of researchers in Germany. The methods that were used were blood samples from 2,365 pregnant women, and they were tested for hepatitis B surface antigen and anti-hepatitis B core. And when the results came out to be positive, these anti-hepatitis B core positive were further tested for hepatitis B virus, DNA, and anti-hepatitis B core. There were 105 of the children who were tested, and these children were from the mothers who had anti-hepatitis B core positive. Some of the techniques that were used were PCR, and assays used were vaccine, and there were different kinds used according to what they were trying to find or detect in the patient. Results. 2,365 hepatitis B surface antigen negative women were who provided blood for analysis. 147, which is 6.2%, were anti-hepatitis B core positive. 105 anti-hepatitis B core positive women provided informed consent to have their children tested at the age of 3 to 4 months. Table 1 shows the result of 7 hepatitis B virus infected children and their mother. And as seen here, we have the mothers and the child. And the child, when the 7 children, they went over 2 different exams. And these show the results of hepatitis B surface antigen test and the anti-hepatitis B core test. And then these were the level of vaccine given to them. And here we have the 7 children with the age between 3 and 4. And some of them tested positive for hepatitis B surface antigen, and some of them tested negative. And there were also different positive or negative for anti-hepatitis B and anti-hepatitis core. And here, LLQ is low level of quantification, and NA is no analysis. And we have only five tests done for 5 children because these 2 did not follow up, had no follow-up exam done. And here we see that after giving a number of vaccination, the hepatitis B surface antigen are all negative. And so our anti-hepatitis S, anti-hepatitis E test, and here is hepatitis virus DNA PCR results. And we can see a negative result, while over here we can see a positive. So in discussion, women who are anti-HBC positive but have HBsAg negative can transmit hepatitis B virus to the infant. Greater than 7% of these infants who were found to be positive for hepatitis B virus DNA or hepatitis B surface antigen. None of the 105 children developed chronic hepatitis B virus infection, and chronic, again, I would like to repeat, is a long term. And the 7 children who had markers of HBV detected at birth seem to have cleared the infection over the following months. And also, the assays yield false negative. This would be the case especially as for child 3 if the viral loads were too low to create an hepatitis B surface antigen for negative results. And I don't know, it's going by itself. Okay, and so children born to hepatitis B surface antigen positive mothers received active and passive vaccination. 92 to 94% of these cases of chronic carriers can be avoided with vaccination. In conclusion, substantial number of infants born, I'm sorry, it's just like going back, so I have no idea. Alright, substantial number of infants born to anti-hepatitis B core positive mothers showed ocular hepatitis B virus infection. So, blood transfusion and organ transplant from person who's positive for anti-hepatitis B core can result in chronic hepatitis B virus infection in recipient. Therefore, blood and organ donors are screened for both hepatitis B surface antigen and anti-hepatitis B core. And it is never too late to start active vaccination for all children at the age of 3 months, and a complete and active passive vaccination immediately after birth can prevent future hepatitis B infection, and also the cost effect because it would avoid lifetime costs of managing chronic hepatitis B and all of its known complications. So therefore, acknowledgement, I would like to thank the Science Department and Dr. Halls and NCBI for providing me with a lot of research, and there are a lot of research done on hepatitis B, if you guys would like to go and check it out. And there is also a bright future for hepatitis B with a cure. Any questions? I know that was a really bad, kept going on myself. Yeah.
Do you know anybody who's had hepatitis B, or what made you choose to research?
A lot of my relatives and a lot of people I know who are in Tibet have hepatitis B because of there was a lot of spreading of hepatitis B in the back in times, but they didn't have vaccinations during that time. So a lot of people I know are carriers. But my little cousin sister who was born in the United States, she had hepatitis B from her mother, but she got a vaccination when she was born, so she doesn't have hepatitis B. So that's why I was very interested in hepatitis B. Yeah.
You said that there's a bright future for hepatitis B in terms of finding a cure. Do you know anything about hepatitis C in terms of finding a cure?
No. I think that's me being selfish because no one I know has hepatitis C, so that's why I wasn't very interested in that. But I feel like if people did research on that, and there used to be no vaccines for hepatitis B either, but they did find, and they did a lot of research. So I feel like if they did research on hepatitis C, someone will find a vaccine for it. And I'm sorry about flipping, I don't know, just clicker or something. It just kept going by itself.
The use timings button. Unclick it.
Oh. That's it.
Yes. Other questions?
There you go.
All right, let's thank the speaker again.